In the last section, we introduced using props in order to start making corrections. We're going to progress that idea and with another series of props referred to as posture pumps. So once again, these are fantastic devices, very commonly used by practitioners by themselves, and without a doubt, they're very beneficial just to use them by themselves. But as we start looking at the concepts of enhancing great ideas, there's only one ideal neutral posture, and everybody agrees on this. So most of the time when we work on people, we're correcting people in their abnormalities and we're still getting great results, and we're trying to condition them to move them into this more ideal posture. Depending how you bring these things into your clinic, they work good just to be used by themselves. Many people will even sell these to the patient to be used at home because this is a benefit. We always want people to heal when they're not in front of us. However, there's also another benefit that these provide to us in terms of what if we recreated the ideal curves in the body and then made certain corrections. Absolutely, it's going to help upregulate the body, and this goes for laser, percussor, and adjuster. Now in the advanced DVD volume 1, we go into great detail using these in terms of what's called structural dynamics. Now we're not going to go into that detail here, but since this is a percussor adjuster DVD, we're going to go over the concepts and again just how valuable these are in terms of bringing in to make soft tissue and certain basic structural progressions. And then obviously, as we talked about in structural dynamics of doing brain balance, gait, sympathetic, parasympathetic, using the red violet in combination with everything we're going to teach you here, that's described in details in the advanced volume 1 DVD. But as we're looking at just our percussion and adjusting applications and how this works, it's pretty basic and obvious to the patient and even the audience. Now, as we discussed in the SOT section, using that double arm test, there's a lumbar we're going to use and a cervical. If this is going to be good for her, you just take a straight arm, double arm test. If she stays strong, you're good to go. If she went weak for any reason, we either have to adjust this a little bit or there would be some corrections that would need to be made before we could progress and use them. But again, we're finding this, that it's very, very safe for her. Now you can clearly see on her neck. This isn't hard to see. Patients can obviously feel it. And when you can see the significance of the change in how she's just nicely harnessed in, and you can imagine how this is just easily recreating that ideal cervical curve. It's not just your bones are out of place, it's the soft tissue, it's the joint capsule, it's the dura, it's all of the above, and very nicely the posture pump will just help work those tissues. However, as we're going to start applying this with our patients, even just starting systematically, you can do this globally. You could use the cervical and the lumbars together. We're just going to kind of stack this on top each other again. Now, sometimes it's kind of hard to use the percussor on the cervical area. I know Dr. Dan Murphy, he does use the fascial roller, but just as we get in here very easily, I mean, you could take the laser, you could position it to help what you're doing. You could get some gel on your fingers, or you could sit in here and you could palpate that SCM scaling, find some of the big crunchies, and we could be lasering them, and you could manually just be working the trigger points. If you had some lube out there, you could be stripping those muscles with your thumb. I know Dr. Murphy, he does use the fascial roller in the percussor, not necessarily on a posture pump, he doesn't, but just by itself. So, you know, you can do what's comfortable for you. I'm kind of a manual guy as I'm into the cervicals here. But everything we've taught you before, but we're just kind of building on this concept. And even again, how we're looking at this global biotensegrity. As we make changes with the percussor, whether it's in the upper body, through the diaphragm, as we start working the psoas, the lymphatics area, every section that we have taught you throughout this DVD series, you absolutely can bring in and to apply by using posture pumps. And it just makes sense to start using props that you can actually start recreating these ideal postures through the body, and how it starts making changes, and how it's these changes that we want the fascia, the muscles, the soft tissue, and the structure to re-educate themselves to. So instead of working on people with all their abnormalities and train them to move forward, we put them in that ideal posture and we make corrections, and it can help people progress and move so much faster because their body's completely aware of what you're trying to do to it and make those different types of corrections. Now, even using the cervical, we can even bring the SOT blocks into it, like we talked about in a previous section. So we already kind of know her pattern, and absolutely you could be doing SOT blocks while you're having the posture pump. Same rules apply. You know, whether we're looking at the adjuster, and we can even, this is a great way to bring out anterior cervical subluxations if they're not too severe, and make corrections too. We're opening up that joint space, and this is a great way to apply the adjuster into some of those anterior subluxations. So even though we got her on the pelvis here, we're going to get into the block, so we can come in here, and whether you palpate or you therapy localize, and we're just going to go segment by segment. And we're just going to check her, and here we go. We got one right there. So I like taking that tissue pull. I like going somewhat through my thumb and through the skin to preload the device, and just gently help make that correction. And some of these anterior cervicals, anterior uncinnates, you won't be able to find until you put them in this more ideal position using the retaining principles that we're using during the posture pumps, and then they will clearly show up. And again, the neurological correction that's occurring into the body, your body will greatly appreciate it. Again, you could be going into the percussion techniques in some of the basic areas, or even doing scar technique. You could be using the fascial roller while you're using these props. We're also going to integrate and bring in the lumbar posture pump, just making sure as we're working on her here, she's still good. Now the hoses are supposed to go off the right side. Bend both your knees up, lift. You position this so you can center it. And again, it's going to go on your low back. We're going to probably bring it up even a little bit. Now the cervicals doesn't have much variability. The lumbars has a lot of variability. Now she's really flexible. Most patients, though, you're going to keep their knees bent when you do this necessarily, when you put the lumbars in, unless they start. And again, we can check her. Is it good for her? Once again, if she went weak, you have an option of pushing it up or down just a little bit. You've got more variation in the lumbars as far as how you're going to use it. You could go treat somebody in another room, just position the laser over areas of necessity. Obviously, this again can be pretty nice correction in terms of the lumbars. But once again, if we can create this lumbar curve, these ideal curves, and start doing some of this soft tissue work, upper and lower, we're really locking these things in using the laser at the cellular level, as well as making these structural adjustments and these fascial corrections using the Percussor Adjustor laser by using them on posture pumps. It is a fantastic technique to implement into your office as people graduate certain levels, or if they plateau at a certain level and you're like, I'm just not finding the indicators. You start bringing some of these things into play, and it becomes very obvious an entire next level of correction that's still available. So again, start using props in your practice, apply the distinct chapters that we've taught you, and again, combining these things will absolutely guaranteed get people to that next level, and it's really pretty effortless in order to implement them all together.